Grey County.
Hello and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and today I am delighted to welcome three guests to the program who will be talking about the Community Safety and Wellbeing Plan. So I'm going to introduce them by name, but then I'm going to ask them to just take over and describe their current role, because roles have certainly changed during COVID-19, and then to talk a little bit about their involvement with the Community Safety and Wellbeing Plan. So in no particular choice of order, just the way it looks on my screen, I am delighted to welcome Christine McDonald, Tanya Roberts, and Jason Weppler. So thank you to all of you for being on the program. And I'm wondering if you can just introduce yourselves and then we can go from there. Do you want to go in order?
Sure, I'll kick things off. Thanks for the warm welcome, Carol. Christine McDonald. I am currently the interim Chief Administrative Officer for Bruce County. Previous to that, and I will return to my role as Director of Human Services for Bruce County, and that's really what kicked off my involvement with community safety and well-being planning. I'm a member of the advisory group and the steering committee and provide leadership oversight to the initiative, along with my counterpart, Barb, Fedy in Grey County. And I'll turn it over to whoever's going next.
I can jump in then. My name's Jason Weppler. I'm one of the program managers at the Grey Bruce Health Unit. I'm probably the most recent addition to the steering committee membership for this plan. I had originally sat on the advisory committee since the outset of the plan, and then moved into this role with some internal shuffling here at the health unit. So very happy to be here and look forward to the conversation.
Okay, and well, thank you for the welcome, Carol. And my name is Tanya Roberts, and I'm the Community Safety Wellbeing Planning Coordinator. So working with our, as we'll discuss more in this session, working with those action tables and coordinating all the different implementation aspects of the plan.
Excellent. Welcome to everyone. And I've had the pleasure of sitting on just two meetings, actually, of the Community Safety and Wellbeing Plan with a totally different hat on. And I am just so pleased to be able to speak to you more about it, because I am excited about what the plan can bring to Grey and Bruce. So just wanted to mention that I had a little bit of a sneak peek preview by having sat in the conversation. So before we talk about the history of the plan, I'd like to talk about the goal, and then maybe somebody can talk about the purpose. But when I received information, I thought the goal, and I'm assuming this is the current goal, so I'm looking to all of you to correct me if I'm wrong, but the goal of the Community Safety and Wellbeing Plan is to achieve the ideal state of a sustainable community where everyone is safe, has a sense of belonging, opportunities to participate, access to services, and where individuals can meet their needs for education, healthcare, food, housing, income, and social and cultural expression. And when I read that goal, my immediate reaction is, wow, that is amazing. So where did it begin? Where did this idea of a community safety plan come from, and maybe how COVID has impacted how it's rolled out? So who would like to give the history?
Well, I'll maybe take a start, Carol. And of course, Jason and Tanya, welcome to add in at any point in time. You absolutely have the correct goal. You are right up to date. And you said, wow, it also, when you stop and reflect, is lofty, right? There's a lot packaged in that goal. And so really where did this all begin is we were talking about crime prevention and how do we prevent crime, and in doing so, build safer communities. And what we realized through the Community Safety and Wellbeing Framework that was produced by the Solicitor General is that really we have to think about how we prevent crime in how we develop communities. at the same time that we continue to respond to crises and emerging needs that occur. And so really the origins of the work are in crime prevention. But there's complex problems in our communities. And so in order to really address those complex problems, we have to get to the underlying foundations of what does create a safe community. And so there's a lot packaged into doing that.
For sure. So when you mentioned the Solicitor General, so is this a legislated requirement for us to do by law? By law, we're supposed to do a plan, correct?
That's correct. And in the situation where we have an upper tier and local government, a two-tier system, it's actually currently legislated that it's the local level municipality's responsibility to have a community safety and well-being plan. The legislation, though, also speaks to all the stakeholders and partners that are to be involved, which of course includes public health and education and human serving organizations. And as we're aware, many of those organizations cross the region of Grey and Bruce for us. And we have a rich history of working together collaboratively to solve these challenging, complex issues and to do proactive work. And so it just made sense for us to join together to create a plan for the entire region. And then from there to identify actions that will happen regionally, as well as in some cases where it'll be specific to certain areas of the region or even certain municipalities or communities.
So how did you even begin to put these ideas, these concepts down into paper? Were the public involved? Did you do input? I mean, because I've certainly seen the documents. How did it evolve? And I'm not sure who can talk about the next steps.
I think the community engagement piece is a great piece for Tanya to speak to. Tanya, if you want to speak back to the survey that included public consultation and some of the work that happened in 2021.
Mm-hmm. Yeah, just to speak to the engagement, there were public consultations and community surveys. So there was two community survey perception surveys conducted, one in 2021 and then a comparative, one in 2020 and then a comparative in 2021 to identify those impacts of COVID. So there were over 2,000 people engaged, I believe, in the early consultations, the public consultations, and there were well over 1,000, close to 2,000 engagement surveys conducted in the first phase or that first engagement survey. We did see numbers drop a little bit in the second engagement survey, but the results of those surveys, which are now available, did show that we've, kind of benchmarked against what people's perceptions were against those 5 core risk priority areas, and if that changed during the pandemic. And so the results showed that did stay the same. There were some slight changes in what people thought were the number 1 risk priorities, which those survey results show, which we'll discuss later on in the future. But certainly there were many different consultation, in-person public consultations, and also surveys, feedback surveys to the public.
So Jason, the Grey Bruce Health Unit mandate is to work towards community well-being and partnering with others. So maybe you could speak a little bit about the role of the health unit, and then I'd really like to talk about those 5 core risk areas, because I know that there is lots packed into those and action tables as well.
Yeah, so Carol, the Grey Bruce Health Unit is one of 5 core members of the steering committee. So both Bruce County and Grey County are represented, as well as our local police services. So Krista Miller, the South Bruce OPP Detachment Commander, is also a steering committee member, as well as Grey Bruce Huron-Perth Victim Services. So we are just one member of that steering committee who is helping kind of drive the work of this committee. So we do meet regularly, and as you've referenced, certainly health, safety, well-being are certainly all part of the Grey Grey Bruce Health Unit mandates. So it certainly aligns well with our work. And then, of course, we have lots of supports, Tanya in the coordinator role, and then we have a very large advisory committee, which you yourself are part of as well, to help inform and drive the work. And then, as we just referenced, I think that community engagement piece is super important as well. Without the public, we wouldn't have that input to be able to focus on the priorities that we're going to speak to here in a moment.
So the impact of COVID on how this plan has moved forward. I mean, COVID seems to, I'm not sure it hasn't impacted anything. So what happened to the plan? Because people were certainly pulled in many different directions with COVID as far as priorities. Did it sort of stay put? Were there actions happening? I'm wondering who can speak to that.
Well, perhaps I'll start. We have a dedicated coordinator that's working on this project. And so with having that resource in place, it allowed us to keep some momentum. Definitely in some of our counterpart regions, I know they did put pause on the work. Something that we saw is really important during the pandemic is that the community safety and well-being plan has the opportunity to help us respond to the needs of the pandemic. And then as we move into recovery modes and now into endemic, and we're in sort of a new post-COVID reality at some point in the future, we saw the community safety and well-being planning work as being crucial in helping keep our community on track and keeping attention to this. So with having the dedicated resource of the coordinator, we did keep our momentum moving forward. We were one of the areas that were able to meet the original deadlines that the Solicitor General had put out. And as well, our various participating action tables that we've identified through assessment in the past year were still working. They were responding to needs in the community throughout the pandemic. So yes, it's affected us, but I think what we tried to do is look at how can we use community safety well-being as sort of a tool or an approach that advances and supports us during this challenging time.
Earlier in the program, we talked about the partnerships and how important that is. I think having that collaboration and being able to work through COVID would seem to be a strength in Grey Bruce. And that COVID, for all it's been challenging, has almost reinforced and strengthened that collaborative work together, which I'm hopeful will translate into even more action. But that's certainly what I hear from people, and sometimes even unique and unlikely collaborations and partnerships have arisen that, I think creates great opportunities and certainly might as well for this plan. So I'm very interested in the core risk priorities that evolved, and what do you do with those once you identify them? Tanya, did you want to speak to that? Yeah.
Sure. Yeah. So the plan indicates once those core risk priority areas, so we have 5 that were identified. And so we're building, there was an assessment tool created to a process that we use to assess already existing tables as good matches for community safety wellbeing planning action tables. So we've gone through those assessment processes and identified 3 strong fits as community safety wellbeing action tables for homeless, housing and homelessness, for poverty and income, and for addictions and substance use. So we formed a working group with those tables. And the indicator report provided, as Christine mentioned, some robust data around just some baseline indicators for identifying, for seeing those issues, those themes, those patterns of what our problems are in these areas. And we created an indicator framework in this working group to conduct a gaps analysis. So really understanding what at a local level is within our range of actions, when we discuss those short-term, medium-term, and then longer-term planning goals. Those short-term, what can we action? What is the table already working towards that these indicators highlight as an issue of concern? Just building that understanding and that scope of problems, and then we are working on developing action plans and an evaluation framework. So with those tables that are already identified, again, already existing, those subject matter experts on those issues, working with them is really critical for the success in those outcomes. And then we did identify in the other 2 risk priority areas, crime prevention, mental health, considering, the complexity and the overarching, they touch on so many different areas. We are in the process of identifying potential action tables or creating new action tables. So we're in stakeholder discussions, and then we've developed a terms of reference to start a new table on crime prevention.
So I'm just going to go through the 5 areas, and there was a difference in the priority scale, correct me if I'm wrong, from the first survey to the second survey. And I'm wondering if we can maybe talk a little bit about why that may have changed, and will it make any difference as you move forward with the action tables? So mental health, addictions and substance misuse, crime prevention, housing and homelessness, and poverty and income were kind of the 5 categories. So what changed between survey 1 and survey 2 around the priority? This is not a memory test. But I recall.
I can jump in there, Carol. So we did see in both surveys, both the 2020 and 2021, the top 5 were still clear, but we did see a flip on the first round. We saw that substance and addiction was the highest priority, whereas in 2021 we saw mental health leapfrog over substance into the number 1 category. So I don't think that's maybe to anyone's surprise. We know that COVID has greatly impacted the mental health of many individuals and our residents. Not that substance and addictions haven't as well, but I do think that mental health has certainly risen to the top. There's been lots of challenges financially, socially. We all know that as a result of the pandemic. So we did see that one shift between the 2 engagement surveys, that mental health in the second survey was the number 1 ranked priority through those survey responses.
Will that change anything around how the action tables prioritize, or will it change the frequency that they would meet to attend to certain issues, or will the plan continue?
I really think the plan will continue as is. We haven't really put any more focus on any one of the 5 priority areas than the other. We're trying to move them all forward simultaneously. Certainly, as Tanya's referenced, the ability to pull those action groups and tables together have happened at different periods over the past year. But again, we're equating each equally. So I assume that all 5 will continue to move forward, and we'll certainly direct our attentions equally to all 5 of those priority areas.
Tanya, you mentioned content experts that they sit at the tables and provide input. How do you select those individuals? And then how does the public get involved? Are they at the tables as well, or how will they be kept up to date about the plan as it moves forward?
Yeah, so there was an assessment tool developed by the advisory committee, approved by the advisory committee to use to assess the different existing action tables to see if they were, there were different, there was an activity with the advisory committee on brainstorming around what tables could become community safety wellbeing action tables. And there were key categories of like regional, regional level work that they're doing across Bruce and Gray. So those 3 action tables that we did identify had gone through that assessment and were a strong fit. And then the advisory committee approved those action tables as community safety wellbeing planning action tables. So there was a process involved in that. And those tables, the people that sit at those tables and their steering committees and their public involvement, it was already existing. And so working with those tables made sense because they were already kind of knee deep in those issues. They really understood the challenges, and they had the people around at the table, or there was opportunity to kind of revitalize or, different ways to kind of get those leverage the community safety wellbeing planning or plan at those tables.
If I might add, sorry, Carol. I was just going to say, I'll add another piece too, in addition to our priority areas. As we had mentioned earlier on, there is a role for the local municipalities as well too. And so another working group that meets regularly is our municipal representatives that are involved. And that group is working together to really look at how do they self-assess in their individual communities and in their individual organizations, how they support community safety and well-being at a local level, and how they interact with the public in doing so as well. So we're really trying to look at how can we maximize interactions at various levels with the right people at the right time to engage them in those processes. Yeah. So there will be a key place where members of the public can engage with their local municipal government, through a variety of measures, committees, etc., to really have their voice involved in this as well too. And one other piece is we do have our website for the plan, and so that's a great place for the public to keep up to date and engage with materials that are available as well too.
So the public who are watching this, our viewing audience, the website, do you recall what the address is, that we can just even say it on the program as well? So anyone can jump in with that. But when you mentioned the municipality involvement, every single municipality had to sign on to this plan, correct? Like this, an agreement that they've made to participate.
Yes, we do have a unique and interesting agreement because it is between the two counties, as well as 16 of our local level municipalities in our area. And the 17th municipality does engage with us and has ongoing conversations about how we interact as well too. So we do have full participation of all of the municipalities in Grey and Bruce involved in the work, and our website is the acronym, so CSWBP brucegray.ca. So if you put anything close to that in your search bar, it's probably going to pop up for you.
Excellent, excellent. Because we do want to encourage people to go in and take a look. There's a wealth of information about the plan already, and certainly for individuals to wonder, or if they want to know where it is, to certainly go into the website. So as we're moving through past COVID, I say that with a smile, and recovery, you do have a timeline for this plan, and I'm reading you have different phases. So I'm wondering if you can speak to what phase are we in and what's coming in the next phases.
Yeah, I can jump in for that. So yeah, you are correct, Carol, in that it is a 5-year. The plan was developed for a 5-year period, and then at that time to be reassessed. We realize that a lot of these objectives being these very large goals that we have, these outcomes that we're seeking might take longer than 5 years, will likely take longer, many of them, than 5 years. So the ability to kind of reassess and revise as needed after those 5-year terms. But we are working with those action tables again on those kind of short-term, medium-term, and then longer range goals or outcomes for the plan or for the planning work. So that is under development. And then once we've just entered as of 2021 into that implementation, which is our phase 2. So it takes some time to get all the partners at the table and agreeing on a direction, and then now we're implementing the plan. So we're still in that storming and forming stage. Something just to just remind ourselves, it does take time to really we're taking the time needed to do this right. date. So
Yeah.
really kind of assessing and taking that time. So we'll be developing those different range goals.
Yeah. And it evolves right up until including 2025. So, there's certainly time built in for that. So as I'm reading the phase 2, which is the plan implementation, you had some bullet points in the presentations that have been given. So it talks about a star refresh. And I'm wondering if someone can speak about that, because we've talked about planning and action tables, but there's actually things happening as we speak on the ground. And I think it's important for people to be aware of that. So who'd like to speak to the star refresh?
Well, I wonder if I start, and then I think I'll pass it over to Tanya for some details as well too. But STAR is an acronym for Situation Table of Acute Response. And so the Community Safety and Wellbeing Framework really is about addressing at different levels what needs to happen. And so anything from social development, prevention, risk intervention to emergency response. And so the Situation Table of Acute Response is really about the third ring in, which is risk intervention. And so we have had a situation table in place in Grey Bruce since 2016. However, with the connection to community safety and well-being, in the last year, we decided it was important to do some evaluation, a bit of a pulse check and a refresh to align it to the new plan and think about how we can continue to respond to immediate needs of individual households quickly. So when they're in an acute situation. And so there's sort of some history to it where we had something that was happening. We've done a refresh to rebuild it. And then Tanya, as the coordinator, facilitating that process with all the other community organizations involved in the situation table. And at this point, I turn it over to Tanya to give some more details on what's happening as the situation table evolves and some of the results that they're seeing right now.
Excellent. So in less than 2 minutes, it's yours, Tanya.
All right, I'll try to speak fast. Okay, so yeah, just in a kind of summary, we've had, so over those 5 years, there were about 17 total situations filtered through that process. And then from July 6th till the end of December 31st, 2021, we had 9 situations filtered through that process. And then since January 1st, we've had another 6 filtered through that process. So it's great, that gives us an understanding of some of those key risks and provides data. The situation table is, we use a risk tracking database. So those study flags that we process through this, through the STAR table, then goes into a risk tracking database where we can identify trends, risks in the community, and then for better evidence-based decision making, and that filter through the advisory committee. So, always using these facts and data to help make better decisions at that regional system level planning table. So yeah, it's been great just to see the agencies, the police services, coming together and wrapping services around people at high risk. It's been a really positive outcome, and it's really inspiring to see all these people working hard together to help mitigate those community risks. So, but we understand their challenges. There are challenges that also those system level issues they identify and they bring up that then we can kind of have larger discussions about. So,
excellent. I can't believe our time is up, but this is an exciting topic. I want to thank all of you for being on the program. I've certainly learned, and I'm looking forward to also sitting at the table and learning more. Thank you to our viewing audience for being with us today. To learn more about programs, resources, and services available to you and to your family, take care and stay safe. Thank you.
This program is brought to you by NBA League Pass. More dunks, more slams, more to love, live in HD. NBA League Pass, part of the Rogers Super Sports Pack.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
As the fighting continues in Ukraine, thousands of people are fleeing for their lives, forced to leave everything behind. You can help them. Your donation